it's a good afternoon from and on behalf of the three co-sponsors of this platform that we all, the University of Washington, Sambodhi Research and Communication Organization, as well as ISRN India, are planning to launch with the aim that will be actually discussed with the two organizational representatives who will follow soon after I finish introducing the topic. But basically, COVID-19 is what we all been spending almost most of our time gated out of the communities back into our homes, and the organizationally this epidemic or this pandemic has challenged across not only the lives but also the livelihoods. So we will possibly see what has happened in the past 4 months, and soon the speakers will take on, but I will just introduce the topic. And if I can take the slides on, uh, can I take these two slides, or you're going to help me? Um,
Sir, are you able to share screen, or would you like me to?
yeah, if you can bring me the slides up.
I'll do that. Just give me a second.
Okay, so essentially I'm going to show only 3 slides with the COVID-19. The major characteristic of this pandemic as we see it is between the people who come with disease and symptoms versus people who are asymptomatic. I mean, this is not unusual for an infectious disease epidemic, and especially the respiratory epidemic. But what it shows actually is that out of the 10 people who are actually infected, 2 of them have some form of disease. A quarter of the 2 would have very critical severe illnesses requiring an ICU, while the 75% of these 2 with disease are mild and moderate and do not necessarily need any ICU interventions, but may require hospitalization. So that gives us an impression of what kind of health services we are looking for. The major concern really goes around here, the 8 of the people in the iceberg. So this is what I'm depicting as an iceberg. 8 who are asymptomatic, and most of the time they are left out of the testing system in most countries because they can't cope with it. And they are the ones who indefinitely, but for certain period of time that we are hearing now scientifically, are able to transmit infection and are very, very important from the epidemic point of view. The next, please. There are essentially 4 stages of COVID-19 that I think we all want to catch on with. The stage 1 and stage 2, where most African countries and the participants who are connected with this platform, they are actually in stage 1 and in moving gradually to stage 2. So the stage 1 is where the infection is introduced for the first time, while the stage 2 is the local transmission to close contacts and their groups and their own families and communities. The third one is, which is a massive exponential transmission that occurs in terms of communities where people are not able to trace the source of infection. And stage 4 is the widespread outbreak of the epidemic, which is presently, of course, has no end in sight, and most of the countries like US, Italy, and Spain are going through those phases and maybe gradually settle down. Now, beyond stage 4 is what resolution seems to happen. And so when these 4 stages were done, the epidemiologists were not sure what to look at beyond. And that's what has happened in Wuhan, is the subsequent stage of resolution, and as they claim to be 0 cases. The next slide, please. So the 6 webinars that we are now decided on these topics is the first one that we are doing today is global epidemiology. The second one will be on pandemic preparedness and response measurements, looking at the mathematical models and other ones that show the trajectory much more clearly. The diagnostic and testing, the fourth webinar, which are weekly webinars, will discuss the treatment and vaccine development. The fifth one will be personal and institutional preventions. And the sixth is the social and economic impacts. So essentially, this is how we intend to go through the knowledge sharing process of these webinars, but that is the launch process of the network platform that we talked about, the global COVID-19 network, which will be launched and carried forward by the 3 co-sponsors, namely the University of Washington, Seattle, Sambodhi, as well as ISRN. So I think I will stop here, and I will request uh, Mr. Sudhanshu Malhotra to come in and introduced the organization called Sambodhi in India, so that everybody is able to get introduced and see how we are going to be bringing the strengths across all the co-sponsors.